Virtual patients. Virtual patients may take a number of different forms. Case presentation. Review of patient-related cases to reinforce and apply primary medical concept to real-world situation. Interactive patient scenario. Multimedia patient case designed to teach clinical reasoning skills such as diagnostic, test ordering, and interpretation. Virtual patient game. Interactive clinical scenarios that take place in an entirely virtual world designed to practice team training in high risk situation. Example: avatar within a virtual health facility. How virtual care benefits patient. Perhaps the most silent benefit that virtual care offers patients is convenience. Instead of traveling to and from a hospital, clinic, or other healthcare facility to meet a doctor or clinician, virtual visit empower people to confer with their caregivers from the comfort of their own home. And it isn't just about comfort. In rural areas, the ratio of patient to primary care physician is less than 40 doctors for every 1 lakh people. Notes the National Rural Health Association compared to 53.3 physicians per 1 lakh patient in urban area. In these areas, virtual care offers not just convenience but actual access to caregivers that patients wouldn't otherwise experience. Beyond primary care, virtual care also increases access to specialists who may be even further out of range, not just for patients in rural areas but even for those who live in small cities or suburbs. Patients may also experience lower cost with virtual care, which tend to cost just $40 to $50 per visit. Notes, notes Heidi Godman at Harvard Health blog, or about half the cost of an in-person visit. Application of virtual patients. Trial outcome prediction proof of concept. One potential use of virtual cohorts is to simulate a clinical trial in advance of investing in the actual clinical trial, assuming the simulation are expected to reliably predict the clinical endpoint of interest. The advantages are clear. Millions of dollars could be saved if the VT prevent a failing trial going ahead. For example, in 87, the author used a VT to retrospective respectively recreate the result of RIME ID goes head-to-head trial, which compared performance of two ICD devices. The conclusion of the right trial was the opposite of what had been hypothesized at that time. The virtual result reproduced these results. Responder identification. Related to prediction of trial outcomes is use of virtual cohort to identify individuals who are likely or not likely to respond to the therapy, for example by identifying subpopulation within the intended patient population for which the proposed therapy is not likely to be effective. Studies using virtual cohort could be used to derive better inclusion exclusion criteria for the real trial to reduce the size of the trial while maintaining adequate power. This could be depending on the effect size ultimately be the difference between trial success or failure.